Good evening, Solve.Care community. This is Pradeep Goel, and I am delighted to speak to you all today. It has been a few weeks since we last talked, and a lot has happened. First of all, I have cool AirPods, so you can hear me properly. So last time I know we had some sound issues. So today, I hope that you will have a much better audio. We have a lot to cover, but before we get started with today's agenda, which I will share with you in a minute, I want to share with you a couple of other things. Today's agenda is long, and we probably will not cover it all, and we will do additional sessions. But more importantly, we have a lot of updates for you, and we cannot fit them into a 1-hour session. So Maria and my marketing team will organize additional sessions with you next week, the week after, and the week after. So we're going to ask for more of your time than we normally do, because there is so much exciting updates, progress, and status that we want to share with you. So look for additional invites on the upcoming webinars. And as always, we appreciate your support. We appreciate your engagement, encouragement, comments, criticism, all of it. We are on an amazing journey, and the journey keeps getting better every day. And the execution from the team is fantastic. So the mission is broad and grand. The team is amazing, and the progress is therefore reflective of those two factors. So without further ado, let's get into today's agenda. Today, we're going to talk about the Solve token in its entirety. And I'm going to share with you truly in a fully end-to-end manner how Solve token operates inside and outside the Care network. We have shared bits and pieces of this, but not all of it. So you're going to see the complete picture as only the inside Solve.Care development, delivery, support, marketing team have seen so far. So this is new information mingled in with information that you might already know. So bear with me as we cover this massive topic. But it's very exciting. And why it is very exciting, before I talk about the Solve token economics and the flow, is that our clients get it, and our clients like it. And that's important, because they are the ones ultimately going to drive everything. We have to get adoption. And our clients aren't just consumers. Our clients are primarily enterprise organizations, conservative by nature, insurance companies, government agencies, hospitals, large organizations that self-insure their healthcare benefits, groups and communities that need to take care of themselves. So these are not people that you are just a crypto crowd, right? We are all very much excited about blockchain and its possibilities, but our clients care about their business and how we can help them. So in many ways, this client-centric focus ultimately boils down to clients saying, yep, you're solving a problem I care about. You're solving it in a way I like. Therefore, I'm willing to pay you to solve this problem. And that's the ultimate test of truly value being delivered to the market. So our clients like our model. So I'm going to share with you the model. So I'm going to switch to the agenda slide really quick here. And now you can just hear me but not see me. And I'll come back towards the end of the session when we get into Q&A and switch back to the camera. But for now, let's get started. So we have 10 big topics to cover. Each of them could take an hour, but I'll try to be brief. And then once you see the complete picture, we can always come back and answer more questions. So let's start with, what is the purpose of the Solve token? In a very simple way to understand it, Solve token is a programmable payment and benefit token that our clients, insurance companies, self-insured employers, government agencies that take care of their citizens, large community groups, hospitals, who can program this token inside their care network to deliver the right benefit to the right patient at the right cost, and pay the service provider the right amount of money as much as possible in real time. So Solve token, in a nutshell, has one purpose, which is to deliver the right benefit to the network participant and to make sure it is done and is paid for. It's used to pay for the right service at the right time for the right cost. This is a very big problem in any kind of benefit administration space, whether you're dealing with healthcare in the US, or you're dealing with healthcare in China, or you're dealing with healthcare in Korea, or Hong Kong, or the Middle East, there is always this triangle. The triangle is of patient, doctor, and somebody who pays for the patient to go see the doctor, which could be patient, patient's family members, patient's employer, patient's insurance company, or patient's government. But either way, somebody's going to write a check to the doctor. So the doctor in this case is a service provider, patient is a service receiver, and there is a payer who is actually sponsoring that benefit. And in most cases, you and I pay out of pocket, but in more cases than not, somebody else pays for healthcare. And this triangle is very difficult to administer and very difficult to manage and very difficult to keep everybody in sync, because the person paying the bill isn't in the room with the patient and the doctor. They're not the doctor, they're not the patient, but they are the ones who are supposed to make sure, this third party, that the right service was delivered, the right cost was billed, and the right amount was paid. So this whole model of you going to the doctor to get care and me paying for it is called third-party payments. They're also called sponsored benefits. And these benefits are incredibly difficult to manage around the world. Now, you might say this is a US-only model. It isn't. This model of patient-provider-payer is universal. It's around the world. It's global. For example, in the UK, you have this entity called NHS, National Health Service. They are the payer. They are the third party, because UK citizens can go to the doctor and the doctor will bill the NHS for payment. Similar entities exist in Canada. Similar entities exist in the Middle East, in Asia, everywhere. So in this model, what does Solve token do? What the Solve token does is allows the third-party payer to truly manage who is getting what service from whom, how much is the service worth, how much should I pay, how much should the service recipient pay out of pocket, is there a third party who should share the cost of the service with me, like a family member or an employer or another insurance company, and how much should I pay and when should I pay, and should I pay for the point service was delivered, or should I pay till after I receive the results of that service? These questions are never answered in an absolute yes or no. These questions are always answered in the context of the healthcare system of each country. And we have designed the Solve.Care platform and the Solve token to deliver that programmable token value. Now, with that background, what is really the utility for the client and the consumer? Because while Solve is used to make the benefit payments, it's really a utility token. What it's really trying to do and it's designed to do is to link to the benefit delivery. So in effect, very simply, Solve token moves with care cards. Solve tokens inside the network move when a card is executed either on the patient side, on the doctor side, or on the insurance side. And that card does something, such as gets you an appointment with a doctor, or the card gets you a prescription filled, or that card gets you a Lyft ride, or that card gets you a referral to see a specialist. When a card is activated in the wallet, then tokens can be attached to that card for the outcome. So think of it as a smart contract, right? A smart contract is executed that allows Pradeep to make an appointment with his doctor, and the doctor accepts the appointment knowing that Pradeep's wallet is paired with his. And that execution of that contract results in Solve tokens being moved from my wallet to the doctor's wallet. So Solve tokens move inside the network between wallets based on the behavior and the outcome of the card, which in effect represents a defined set of functions and logic. And in simple terms, the card is essentially a contract between two wallets. The utility of the Solve token from a client perspective is very big. A client as an insurance company can stand up a care network on the Solve.Care platform, invite all their insured members to join that network, invite all their providers to join that network through Care.Wallets. And once they join the network, the client can issue real care cards, real-time care cards to each of these wallets, depending on who the wallet holder is. and they can attach tokens to these cards to facilitate transaction between wallet holders. So for example, I as an insurance company can start up a Care network, publish the wallet to all my members, and I can send them a Care card for making appointments. And when they make an appointment using my Care card to any of the doctors in my network, I will automatically pay the doctor $25 for making and accepting the appointment from my members. So it's called an appointment reservation fee. That would happen automatically because the appointment card is linked to the appropriate number of Solve tokens to transfer it over to the wallet. You can't just send the tokens in the network. You have to link them to a card. And I'll explain why that is. Because we are managing benefits. This is not a PayPal, right? We're not just moving tokens around for the fun of it. We are moving tokens around the network because something meaningful happened for which my tokens should be spent. So that's a utility for the client. I control how tokens get spent, when they get spent, how much they get spent, even though I'm not in the room with you when you go see your doctor. From a consumer perspective, the value of the token is has many facets to this. So as a consumer, I can now do things that would have required me to call the insurance company, submit a claim, and do all kinds of administrative and manual paperwork for me to do certain things. Now I just get a Care card in my wallet to do some things that I would like to be able to do. And not only that, I can now pay using third-party funds, insurance funds, essentially, for the service that I'm consuming. So if I go take a Lyft ride, well, the insurance company sends me a Lyft card. I use that card to take a ride. Attached to the ride card are a certain number of tokens, which tell me that for the first $20 of the ride, it's paid for. There are enough tokens attached to the card that $20 I can take. But if I happen to be further away from my doctor and I need to spend $25, it can take $20 worth of cards tokens attached to my card. It can also allow me to pay with additional tokens for the remaining $5. So from a cost sharing perspective, from an out-of-pocket cost perspective, consumers can spend their own Solve tokens, which are not the same tokens, they're not the same pool of tokens as what the insurance company has. So you can think of this as two big wallets. There's an insurance wallet, what we call the master wallet, and there is a consumer wallet, which is called the Care.Wallet. The Care.Wallet can have both consumer-owned tokens and insurance-issued tokens. The insurance-issued Solve tokens can be used only when Care cards allow them to be used. Consumer tokens can be used more freely. So I can buy services that my insurance company does not sponsor or pay for, but I still want that service, so I can use my own Solve tokens. So that's a utility for the consumers. Now, let's get to the third point. So our main focus has always been to have massive adoption of the Care.Wallet, and the driver of the adoption for our product is the client. We would love to have every consumer on the planet download and use a Care.Wallet, and we will get there. But to get there, we need to first get enough clients to sponsor the Care.Wallet so that they are saying to their members, all of you need to use the Care.Wallet because I'm going to issue you really cool Care cards, and I'm going to pay for services you need through Solve tokens. And this is so seamless, so beautiful, so easy to use. We want you to do this approach versus calling us on the phone or sending us emails or coming to the office or mailing us. We're going to give you a real-time transactional capability to use benefits that you pay for, but you don't really know how to use them properly. So I'm going to give you a Care.Wallet to do that. By doing this top-down model of wallet adoption, where clients sponsor, encourage, and inform the wallet holders to use the wallet because there are meaningful cards in the wallet, is a much faster way to get adoption than if you were trying to convince one consumer at a time to download the wallet and learn to use it. Because now we have an intermediary, a client, who has a strong interest in more efficient benefit administration, accurate payments, reduced costs, better healthcare outcomes for their members, and they have the wherewithal to launch the network, sponsor the cards, and sponsor the wallets, and essentially make it easy for consumers to adopt, and also incentivize them to adopt, and also to some degree penalize them if they don't adopt, right? Because it saves the client a lot of money, and it also produces better results for their members. So clients are the sponsors of our networks, and clients are the ones who then sponsor and encourage and educate the consumers to adopt the Solve.Care wallets. So when does a client need Solve tokens? Well, right at the beginning. When a client turns on a Care network, they have to load in the master wallet a certain number of Solve tokens, what we call the base threshold. That base number of tokens, or the threshold number of tokens, is what is needed for the network to be primed. If you will, think of the network as a car. For you to drive the car, even to the gas station, you need to have some level of gas in the car. So clients need Solve tokens when the network is stood up. But really, they need tokens to fund the actual usage of the network by members. So if you are an insurance company with 100,000 members and you're going to issue 100,000 wallets, then you're going to pay Solve.Care equal amount. For each wallet, you'll pay us a certain amount of tokens per month. And for 100,000 wallets, we can compute that number of tokens. And we then need those tokens to be in the master wallet, so we can withdraw them at the point of renewal, which is monthly. But now, if you're also paying for services like transportation, pharmacy, teleconsult, nurse line, lab test, MRI, imaging, whatever, if you're giving your members additional services, which is, of course, why you start the network, you want to give them all these services, then you have to make sure that there are tokens to pay for those services as well. So you may need to load more tokens in the network wallet called the master wallet. So this is how the client's responsibility flows into a need for buying tokens in the market and depositing them in the master wallet. I'm going to now jump to item number 6, because I want to show you something that we have never published before, which is how the entire Solve token circulation, the journey, how does it work? And this is really interesting and important message. So let me switch to a different page here. I hope you can see it. This is a really important diagram that we have, again, never published before, but I think today is a great day to do so. And I'm going to walk you through everything, starting from the left to the right, so you can understand how it works. So let's start on the left-hand side. So you have a client, insurance company, that has a bank account, obviously, somewhere. And insurance companies, by definition, are banks. They're trusts. They hold money in trust for their members. But they have a bank account. From that bank account, having that bank account allows them to buy these tokens using fiat. So what the insurance company does in our scenario, when they launch a network, they sign a contract with a trading desk. Now, a trading desk is similar to an OTC desk, but not quite. A trading desk is essentially an intermediary that is a registered financial institution that has the ability to receive money from the client in the form of a wire transfer from their bank account, and has the knowledge of how to go and transact on the crypto exchanges, be it Bittrex or Upbit or Qcoin or a dozen other exchanges that are listing and will list Solve tokens in the future, and buy these tokens on behalf of the client. The client has no interest in opening accounts on all these exchanges, right? They're insurers, they're employers. This is unlikely to be their primary purpose in life, and they actually don't want to do it. So what the clients do is rely upon a crypto-savvy trading desk to go buy tokens. So they send the money into a bank account. When the money hits the bank account, we get in the master wallet on the right-hand side a confirmation of a deposit. And when the trading desk spends that money to buy tokens in the market, and those tokens are deposited in the master wallet, we reconcile them. We know now that a deposit and a credit for the dollar amount and a deposit of the Solve tokens, we can link those two and say, okay, the client sent in $100,000 to the bank account. Trading desk used that money to buy, let's say, 1 million tokens. And we can reconcile 100 grand in credit. 1 million tokens came in. Those tokens sit in the client's master wallet, which is a second block to the right. So if you follow the journey, the client drop down is to the trading desk. Trading desk places orders on various exchanges. collects and accumulates a token, and then eventually deposits them into the master wallet on the right-hand side. Once the tokens hit the master wallet, they are ready to be consumed by the network, by the care network that the client is sponsoring. So here the client's role is that of a sponsor, which is why we're calling it client sponsor. The client sponsor has a network for its members, and those members have care wallets. So those are represented in the red circle below, where we show patient wallets, provider wallets, family wallets, and you can have as many roles in your network as you like. Maybe you have a pharmacy wallet, maybe you have a specialty wallet, and so on. But end of the day, you have participants in your network who you have issued care wallets to. So to the degree that you want to give them incentives and rewards for joining the network, you can just send Solve tokens to their wallet. To the degree that you want to use these tokens to help pay for cost, what is called cost sharing of healthcare services, you can send those tokens to their wallet. To the degree you want to handle payments between the care wallet holder and you in bidirectional, both of you can exchange tokens as a means of payment. For example, insurance premium or copay and things like this. So your constituents are in the red box below, and that constituents are care wallet holders. Now, care wallet holders essentially are consumers of healthcare, right? They are either getting healthcare services or they are giving healthcare services. So patient on the left is getting healthcare, provider in the middle is giving healthcare. So they play the role of a service recipient and a service provider. That's care wallets. When these care wallets consume services using care cards, whether they're using Lyft ride card, or they're using a prescription fulfillment card, or they're using an appointment card, or they're using a second opinion card, those cards consume tokens. Either they consume tokens in the form of just a wallet fee, or they consume tokens in the form of a card fee, or they consume tokens in the form of a service fee, right? So for example, Lyft itself, the card is free. The card is available in the care wallet, but when you use the card to book a ride, then that ride costs money, and that ride card consumes tokens from either the care wallet or the master wallet. Now, today we are focused on primarily sponsored payments today, which means that every time a card is consuming tokens in the red circle, it actually is consuming tokens from the master wallet. The user experience doesn't know that, but from a technical perspective, what is happening is that the sponsor of the services is actually paying for the service, and the care wallet holder is literally just using the service and letting the sponsor pay for it. And they don't even need to know how much the service cost. They don't need to know how many tokens the master wallet paid. They just need to know, I went to see the doctor and my insurance company paid the bill. So it is up to the card designer, which is the sponsor's requirements, to publish whether or not we're going to announce to the care wallet holder how much this card actually cost. We may publish that, we may not. Depends upon the card. For Lyft ride, for example, we're not going to publish the actual cost of the ride. For Lyft ride, we only want to show the member whether you owe any money for this ride or not. If you owe any money, we will show you the number of tokens you need to pay out of pocket. If you don't owe any money, how do you care how many tokens your insurance company paid Lyft? Makes no difference to you. You just want to go to the doctor and get the healthcare you need. So depending on the card's purpose, we can either publish the cost of the tokens attached to it or not. When the cards consume tokens move from the master wallet to the service provider wallet. So now let's look at the next column. We have 3 blocks: Solve.Care, transportation provider, other service providers. Solve.Care is a service provider, right? We are providing the service of the network. So client pays us or our service wallet every month a certain amount of tokens for all the care wallets that are in operation. They may also pay us for other fees that they owe us. So the master wallet can be debited by the service wallet on a invoice response basis. The transportation provider needs to get paid the moment a ride is activated and when the ride is completed. So certain number of tokens flow from the master wallet to the transportation service wallet. when the ride begins, and the remaining tokens come in when the ride is completed. This is kind of how Uber and Lyft work anyway. When you start your ride, they put a hold on your credit card. When you finish the ride, they reconcile and they bill you the actual amount. But here they do it using tokens against the master wallet, not MasterCard, Visa. And then other service providers have similar different profiles. So let's say you're a pharmacy provider in the third box. Pharmacy typically wants to get paid before they'll deliver the drug. So when a patient says, hey, I need to buy 30-day supply of a painkiller, and the insurance company is saying, yep, that is an approved prescription. It has a related prescription card in the wallet. We are okay paying this. Then the appropriate number of tokens go from the master wallet to the service wallet. And then and only then, drug is either delivered or shipped or handed to the patient. So the modality and the timeliness of payment from master wallet to service wallet depends upon the service. Okay? So Solve.Care gets paid monthly, transportation provider gets paid at the end of the ride, and the pharmacy provider gets paid before the pharmacy is delivered. So you can see there are different models. Doesn't matter. It's a function of the card to decide when what tokens move. Once the service wallet has the tokens, then the service wallet administrator, which is essentially the person providing either Solve.Care or transportation service or pharmacy service or 10 other services, they have the ability to decide when to move those tokens back to the market. And the way they do that is, and let's take the Solve.Care example. This is probably the most interesting example. So the way Solve.Care does it is Solve.Care then places a sell order from the service wallet to another trading desk with whom we have a relationship, and it's their job to then take those tokens that we have placed in the sell queue and then put them back out in the market. So it's a function of the service wallet holder to decide how those tokens will go back into the market at what speed. And in case of Solve.Care, we also have the Solve.Care reserve wallet, where tokens we don't need to sell or don't want to sell because we don't want to put all the supply back in, they end up accumulating in the treasury. And this is something we'll talk about later in a different webinar coming up as to how we manage the treasury. But you get the picture that the service wallet can hold or sell tokens back in the market at their sole discretion using a trading desk. Now, some service providers are going to be savvy enough to have their own, coin market accounts at Upbit, Bittrex, and KuCoin, and want to do that. So they may not need a trading desk, but most of them do. Most of the service providers we are working with are saying, I love the idea of getting instant payments, but I want to be able to deal with this, conversion of token back to cash using a third party. So they can use that. It's entirely up to them. So that's the complete flow. And those tokens are then back in the market, and then they circulate back all the way to the left and are essentially acquired by clients again. Now, that's sort of the simplistic flow. But what really happens in terms of the token flow is that every stage, some tokens that enter the network stay there. So tokens that the client buys on the left-hand side aren't always depleted on the other side. They don't leave the master wallet. They're simply held there as an escrow because you got to keep a base amount of tokens at all times. So those tokens never really go back to the right. They stay there. And as the utilization of the network grows, the threshold goes higher, which means more and more tokens have to go into escrow in the master wallet. So that's one thing. Tokens that go into the Care wallet may not be utilized for a while, or they may be utilized over a very long period of time. So those tokens stay in the Care wallets. Tokens that actually do move to the service wallet can stay in the service wallet for a period of time, example being Solve.Care. The tokens we earn don't always go back to the market because we are holding them, because we see them as a long-term asset and we want to hold them. So we are accumulating them, the tokens that we are earning. And a certain number of tokens will go back into the supply. But what is happening is through each loop, when the token goes from the left all the way to the right and comes back to the left, there is fewer tokens each loop. More tokens, for every X tokens bought on the left side, X minus tokens get to the right side. Because there are these 3 or 4 holding wallets that have a strong economic or functional reason, each network then ends up with a internal supply or reserve of tokens that are just going to be there because you need to have a baseline in every wallet for it to be functioning properly. So this is a very interesting model, if you fully appreciate it, is that the more networks are stood up, the more the wallets are issued, more cards that are issued, more service providers as they enter the networks and offer their services, the more the residency of the Solve token inside the network grows, meaning more tokens stay in the network, never to come back out in the real sense. They are bought from the market, but they never sold in the market. It's simply a function of the way Solve.Care token flows. It is always going to have a certain degree of residency of tokens in the network, and bigger the network, the bigger pool of tokens are resident in that network. Not in a single wallet, but across the network, which is a sponsored master wallet, the service wallets, and the care wallets. Between those three wallet types, you're going to just have a natural base of tokens that come out of the supply. So that's the complete picture of the one care network. This is just the picture of a single care network. Now, of course, every client has their own care network. Some have multiple or are planning to have multiple. So each network essentially is a replication or a layer on top of each other. So ultimately, our market is supporting multiple sized networks addressing multiple constituents in multiple countries for multiple set of care cards, and each network is a net consumer of the token. So that's the essential important point that I wanted to understand. Let's move back to the topic. Now, I've covered a lot of ground here, so I'm sure many of you who are listening will have questions. And if we have time, and I think we will cover those questions in the remaining 15 minutes or so. But let me go through the rest of the topics. So we covered item numbers 1, 2, 3, 4, and 6. Let's talk about 5. Will clients have to buy Solve tokens from Solve.Care? This is a question that comes up a lot. The whole idea of creating a token economic model is that tokens are supplied by the market to the clients. Clients are using those tokens to fund healthcare benefits. Those tokens are used to pay healthcare service providers, and then those tokens are redeemed in the market at a point of choosing of the service provider. And this cycle funds an independent economic model that nobody controls. So the answer to 5 is no, clients cannot buy tokens from Solve.Care. They have to buy them in the market. And this is why we have been very careful in ensuring that we have good trading desk relationships with reputable companies that our clients, being conservative organizations, are willing to work with. So that addresses number 5. I want to go back to number 4 for a minute. Trading desks. What is the definition of a trading desk? Let's come to that. If you have an exchange, why do you need a trading desk? So exchanges are known to all of you, probably better than I understand them. But exchange is essentially a marketplace for buying and selling tokens. But exchanges have a lot of limitations. Are they regulated? Do they have the ability to handle fiat? Do they have the ability to handle large orders? What kind of risk do you have in trading on a single exchange? And so on. And most clients, being large enterprises, are not willing to deal with individual exchanges or even a group of exchanges. So the function of a trading desk is to provide the client that crypto channel, to say to the client, don't worry about you dealing with 15 exchanges or 3 or 1. We have the ability to place orders on as many exchanges as we need to and buy as many tokens as you want. We'll take care of it for you. And we are, by the way, a financially certified, regulated organization who can receive fiat from you. And we can vouch for the fact that the money won't disappear. So the trading desks that we are working with, by definition, have to be regulated financial organizations or at least of certain reputation and certain capability, that they are not going to present a counterparty risk to our clients. Because we're not talking a few $100s a month, right? A client's consumption of a Solve token in a month is measured in hundreds of thousands of dollars at full scale. We're not talking about somebody writing a $2,000 check. We're talking about an insurance company spending hundreds of thousands of dollars a month to buy tokens. And that's a single insurer. So clearly they need a counterparty they can trust. So we're very pleased to announce that we have signed agreements with 2 trading desks that meet all these criteria. Both having, one is actually a bank, which is then therefore fully regulated bank with a long history. They've been around for more than 70 years. And they have a trading desk that normally does Forex trading and stock trading, who is also now being geared up to do buying and selling of tokens on the exchanges. So that bank is our first reference point for our clients to send money to and receive tokens in exchange. And the second entity is also a regulated entity. While they're not a bank, they have a fully audited, fully regulated, compliant operation where they do trading in different assets, commodities, and other things. And again, by offering them, by using them to do the token purchases, the client has a relatively low counterparty risk. And we will add more trading desks. But this was a really important milestone for us. We literally reached this milestone last week, where we established our relationship with the trading desks. We got them in place, and we then turned around and told our clients, here is option A, trading desk, bank. Here is option B, a regulated broker. You choose who are you going to work with, or you can work with both, and you can place your orders with both. We're not in the picture here. It's your job, Mr. Client, to choose the desk and send the money to them. All we are waiting for is that the tokens to arrive in the master wallet. So this whole journey of building the Solve.Care platform, signing clients, also had this key milestone. Do we have credible and credit-worthy trading desks that we can safely tell our clients, go transact with this trading desk, you'll be fine. So that's a big milestone. We literally got there a few hours ago in terms of in the last couple of days. So I'm very excited because this closes the loop. Because going back to the diagram, if you don't have a trading desk on the left, and if you don't have a trading desk on the right, things get a little bit difficult. We are asking the client to do far more than they are comfortable doing. But having a trading desk that is essentially a financial institution really simplifies the client's adoption of the whole network. That's item 5. We covered that. Let's move to item number 7. This question comes up a lot. How many tokens do clients need? So obviously it depends on 3 things. How big is the network that the client published? If the client is publishing a 25,000 member network, that's one size. If the client is publishing a 250,000 member network, well, that's a little bit different. It's a 10x. If the client is publishing a 2 million member network, that's a different scale. So the number of tokens the client needs to deposit in the master wallet depends on how big the network is. So we charge for the size of the network. And there is a fixed amount per node in the network which the client pays for. And when I use the word node, I don't mean a blockchain node, I need a network node. Then we also charge for other things that the client may pay for. These are service fees, or Solve.Care charges. So depending upon how big the network is and how many cards and how many endpoints they're buying from us, they pay us a certain amount per wallet per month from the master wallet to the service wallet. But that's the base. The real utilization of token on top of that is what cards is the client publishing to the members. So if I'm publishing a Lyft card to all my members as a sponsor of the network, and I'm going to see tremendous adoption of the Lyft because it doesn't require the member to even know what Lyft is. They just request a ride to the doctor, they get the ride, and they don't care how much it costs because I'm paying for it. Then obviously there's a whole different calculation around how many tokens does a client need to operate the network. The answer in short is, how rich is the network? How many services are we offering to the network, in the network, to the member? Is it just appointments? Then you just need to pay for Care.Wallets. Or is it appointments and transportation and pharmacy and teleconsultation and nurse line and medical evacuation or whatever? You will then pay more and more tokens. It really depends upon how deep the network offerings are. But to put things in perspective, an insurance company typically, and I'm going to use US as numbers because these numbers are true for the G20, they're not true for Asia, but they're proportionate. In the US, a typical insurance premium, meaning the money that my members pay me in a given year as an average profile of a family, is going to be between $11,000 and $15,000, right? That's what I'm going to collect in premium. I'm going to collect that either from the member or from the member's employer, but I'm going to collect roughly between $11,000 to $15,000 for a husband, wife, and maybe a child. Now, I typically end up spending 90% of that money back on the member, at least. And good insurance companies spend more than 90, but 90 is going to go out. We know that. So as a result, if 11,000 comes in, 10,000 goes out. So what I'm doing here in the Solve.Care Network is to make sure that those $10,000 that I'm spending on the member every year are spent wisely, and they're spent in a way that the member is happy, they get the care they need when they need it, and they don't have to go through a lot of rigmarole to get the benefits they need because they paid for it. So on average, when I pay out, essentially, this 90%, what is called the medical loss ratio, meaning what do I get in and what do I pay out, 90% or more is going to go out. So when you do that math, you know that 90% of the money is what we want to route through the network as much as possible. Now, we can't do all of it. That's not possible because some service payments will go directly from the insurance company to the provider. But the more service providers are embedded in our network, the more payment will flow through our network, right? Simple logic. So the expectation here is that depending on what country we are in, whether we are in US or we are in Uganda, there is a large percentage of the premium revenue that flows through from the insurance company back to the service provider. We want to flow as much of that through the network because it is more efficient, it's more cost effective, it's more auditable, it's more real time, and you can audit on the blockchain what happened, when happened, why happened, who happened, which you cannot do today because the insurance company can't sit in the room with the doctor and the patient and monitor things. So this is a very foundational statement here, that the richer the network, more tokens will flow per member through the care network, and that's what we're after. Now, looking at just things like Lyft, which enriched our network immensely, I'll give you an example. A typical public program like a Medicaid agency or a Medicaid managed care organization, who might, let's say, have 1 million Medicaid patients, will spend on medical transportation in a single year for these million patients between $50 million and $200 million on transportation. So think about that again. If you have 1 million Medicaid recipients in a single managed care program, and there are dozens of them in each state, I would be spending between $50 and $200 million in transportation. And I would know that at least 10% of that money I'm spending is being wasted on rides that are not necessary, that shouldn't have been taken, or that were overcharged, or whatever. So I have a huge incentive to run that transportation service through the Care.Wallet, so I can make sure that the right person takes the right ride from the right location to the right destination, and they don't end up going to the mall when they should be going to go see the doctor. Because in a taxi with a coupon, I can literally tell the taxi driver, drop me off at that corner, I'm done, and the coupon is paid, and I actually never went to the doctor. But in Solve.Care Wallet, with Lyft Ride Card, you can't do that. You don't actually have the money in your hand to give to the taxi driver. You have a card that calls you a Lyft ride, and insurance company will pay it based on the destination being the doctor's office. So it's far less abusive and far less wasteful. So we are moving one client at a time onto our Lyft transportation service, But we estimate that a single insurance company using our platform in a single year to run transportation service for their clients will save between 10 to 15% in current transportation costs, which means they would save between $5 to $20 million in a single year. That's a huge amount of money even for an insurer, especially because that money is going to waste. It's not helping the doctor, it's not helping the patient, it's just being wasted. So that's the scale of tokens that we expect the insurance company to buy if they want to offer Lyft as a service to their Medicaid population. And the same applies to Medicare, same applies to commercial insurance, same applies to self-insured employers. The dynamics are different, but they are the same. So that's a general sense. I want you to get a sense for how Solve tokens save our clients a boatload of money. So even if we charge them 10% of savings, we're talking a significant revenue to Solve, but a huge ROI to our clients. Let's move to the last question, and then we'll switch to Q&A. The question is, how does a Solve token relate to Care.Coin? So Solve token, obviously, you guys understand, is a utility token which can be attached to a Care card. A Care.Coin is a token or a Care.Coin that is issued by the insurance company if they wish to do so. So think of it as a proxy token that is completely stable in value, that has no fluctuation, no variability, and that Care.Coin essentially acts as a purely internal currency that has neither a buying nor a selling. It is only essentially a payment coupon that operates within the network. It cannot leave the network. So a Care.Coin is different in the sense that if the client wants an additional token that is purely exists in the boundaries of the network and has no existence or redemption or purchase options outside the network, they can do so. This is the example of like a Delta giving you Sky Miles or American Express giving you reward points for using in their credit card. But the only person who can redeem those Delta Sky Miles is Delta. Only place you can go spend your American Express reward points is through American Express. So Care.Coin is equivalent to a reward coin, right? And not every client is going to issue them. Some clients see this as a great value, some see it as not a great value. It doesn't matter. Care.Coin is completely optional. Solve is mandatory. You gotta have Solve to operate the network. The network doesn't run without Solve token. Network doesn't need a Care.Coin, but network can happily support a Care.Coin if for certain type of card transactions, you want to support a purely in-network currency. And there is a real value to Care.Coin as well, but it is nothing compared to the fundamental nature of Solve as a gas, fuel, and the lifeblood of the network. So I have covered all the 10 points, and I am going to now ask my team to give me some questions that have been answered. Have been asked. First question is, I would like to use, so I'm going to switch over to the camera so that you guys can see me. And okay, here we are again. So first question is, I would like to use Solve.Care Network in my health insurance for me and my family. Any chance you guys will offer something for Texas in the US, of course? Yes, we are working with an insurance client in Texas who is very interested in launching a care network of the Solve platform. We are not close to where we can say we are in contracting. I think we are more in the pre-contract stage. And that's true for not just Texas. There are at least 6 other, if not more, but 6 that I can immediately remember, insurers in the US who are looking at launching Solve networks in a specific state or in multiple states. Some insurance companies operate only in one state. Some operate in multiple states, right? Some operate throughout the nation. So depending upon how big they are and what state they want to focus on, what population they want to focus on, we will see networks being launched. Texas is definitely an important state. It's a large state, and we think it's a vanguard in many ways. It's a very innovative state. So we are interested and we are pursuing. But I cannot tell you that it'll be tomorrow, but I expect to say that your answer to your question would be yes. by end of the year or in the next 12 months or so. The next question is this model only available if there is a third party involved or also for individual person who doesn't have health insurance? So today, our launch is around sponsored benefits, right? Because we want to drive adoption and we want to make sure that there is a sponsor of wallets and sponsor of benefits. So that's where we are today. And I think that will remain our focus for this year because we see so much adoption opportunity, so much unmet demand, the US, Canada, Asia, where this model is extremely relevant. And we want to focus on where there is significant spend and significant pain already, right? So in that regard, in the short term and in the midterm, I see us staying focused on the sponsored and managed benefits, where I, the insurer, or you, the employer, is paying for the benefits. And that's where the adoption is going to be very important and much easier. We clearly are going to launch the consumer self-pay model, where you basically buy tokens in the market and pay for it. But it's a longer journey, and I think we will look to do that towards the end of this year, at least not before Q3, more like a Q4 and Q1. But I'm not fixed on those times because the demand on the sponsored side is clearly exceeding our expectations, and that's a happy problem. You want to have better adoption than you expected, not less. So the answer is today's sponsored benefits. It will continue to be sponsored benefits for a short while longer, and then we'll introduce a self-pay model as well, which is essentially saying that you can buy your own tokens in the market and spend them on the network. But for such a network to be valuable, we need to have enough service providers in this non-sponsored network. So it's a natural segue to go from sponsored benefit to unsponsored benefit because you have a rich network. Who would want to join a network that isn't deep and rich? So adding more service providers to the network is critical in making it useful for you as a client, as a consumer. And that's really why we are waiting to make sure that we don't launch things that don't add value to people's lives. So the answer is yes, but not right now. There is a question. What will make Solve better for payments and fiat? And this is a really simple, it's a very complex but simple answer. So fiat by definition is a unintelligent currency. When you send payment to somebody, your dollar doesn't ask you a question. Why are you sending me? How much do they really owe you? What is it that I'm being paid for? Obviously, fiat is just exchange of money. But in the benefit administration model, all the logic of why we are paying, whom we are paying, how much we are paying, how much we overpaid, how much we underpaid, who should have paid half of the bill is all done in centralized systems somewhere in the back. And those systems are ungodly complex and ungodly expensive to maintain. They're called adjudication systems, payment systems, whatever you want to call them. And because healthcare payments are never one-to-one, they're always multi-party and long cycle, trying to build systems that can supplement the unquestioning nature of fiat is where all the money is wasted, all the fraud occurs, and where I as an insurance company lose all the flexibility and you as a consumer get super frustrated. So Solve is infinitely better than fiat because it can ask the questions. Hey, before you send me to the patient, from patient to provider wallet, was the appointment actually made? Given the nature of the appointment, is the right number of tokens going from point A to point B, smart contracts. So in effect, the programmable nature of Solve token in the context of care cards that then transmit the value from between wallets is infinitely better than me building some megalithic system in the back that only I can control and only I can manage, and therefore I'm the only one who can pay. So having Solve tokens in the wallet allows you to make a payment using my money, which you could never do today. Because if I gave you money, you may spend it on something else, or you may not pay the doctor at all, or you may not know how much to pay. So there's a tremendous complexity that gets eliminated. And this is the fundamental revolution of healthcare payments, is that the money is smart enough to ask questions. Why am I getting paid? And that's the value of Solve as a token. That's one of the benefits. See, there are a few more questions. So there are questions about, I service a sensitive population. where making the public identity available at various points along their path could be problematic. How is each client identified? Actually, it's a great question. The identity of the wallet holder is not public. In fact, it is not even necessarily known to the network sponsor. The identity of the Care.Wallet holder as a participant in the network is known only as a participant, to the degree that we need to know whether you're a doctor, if you are, really, do you have certificate to practice medicine? Okay, we need to know that. So therefore, you will join the network with a Care.Wallet as a physician. So that identity we know. But to the degree that a patient needs to interact with you or you need to interact with other physicians, you reveal your identity through the card only to the degree it's necessary. So for example, as a patient, I may want to get a second opinion. I may want to say, you know what, my primary care physician is telling me I have certain disease that's incurable. I want a second opinion, but I don't want to reveal my identity in getting their second opinion. So I can place on the network, on the blockchain, a request for second opinion where I can publish my symptom card, but I don't need to publish my identity card. There's no reason for anybody to know who I am to tell me if I actually, based on my symptoms and my care ledger, have the certain disease or not. So the answer is, in short, we control identity very, very granular. Every transaction, every event, every card determines what level of identity is exposed to the counterparty receiving the card, and you define how much is and is not appropriate at the point of the card issuance. So we are dealing with scenarios like underage population, probably similar to what you're dealing with, population that has been victims of abuse, domestic or sexual or violence or whatever. You have children who are suffering from terminal diseases. You have people with highly contagious diseases, people with addiction and opioid. You have homeless, you have drug addiction, you have all kinds of sensitivities around patients and their privacy. That's fine, because depending on the wallet holder and the role we have given and the cards we have issued, the identity of the wallet holder, the card issuer and the card receiver, both can be protected. They don't need to know who owns the wallet. They need to know this card that I received from that wallet gives me access to certain information. And then more importantly, we have a consent model that we are working on, and we are improving every single day, which is around, if I give consent for you to see my identity, can I also revoke consent to give you my identity? So the answer is identity management, privacy management, consent management are very fundamental issues of healthcare. And we believe we have the most robust model to handle those. I believe better than any other healthcare platform, including electronic medical record platforms, that really should do a better job. I don't think they come close to what we do.